Being a diabetic can stress you out and can make you feel isolated. But eating well with diabetes does not mean giving up your favorite food. To learn more and more about this, we have our next speaker with us, Dr. Arjun, a famous endocrinologist practicing in Kolkata. And to chair this particular session, I'd like to invite Dr. M.L. Bansali, one of the senior most medical consultant, founder member of HDS, and Dr. Somnath Noshkar, one of the eminent medical consultant, associate professor, SSKM Hospital, Kolkata. Sir, please introduce our speaker.
So, good afternoon, everybody. We know that diabetes, lifestyle modification, obesity, all this goes hand in hand. And this lifestyle modification includes exercise and diet, among which, regarding diet, there are lots of myths and misconceptions about the diet. Though there are established interventions like MNT, but the most common question that a physician faces in their clinic is that, Dr. Babu, ki khabo? Although certainly they will not stick to the advice, I mean, in many cases, but this is the most common thing, and this is very important when diabetes is concerned. And for that, we have a very eminent speaker, Dr. Arjun Baidya. He's MD and DM in endocrinology. He needs actually no further introduction, so without wasting much time, sir, the session is all yours.
Thank you, Dr. Somnath, for your kind introduction. Actually, I got the topic 2 or 3 days back. When I got the topic, I thought, actually I was clueless. What about the topic is? What to talk about this topic? So then I rang the organizer. Please close the door, back door. Please close the back door. Please close the back door. So then I rang the organizer and I asked them, is there any twist in the topic? They just said straightforward, no, it is a clear-cut topic of diet in diabetes, type 2 diabetes mellitus. Then I started to think deeply, little deeply, and I think, what are the elements in diet in diabetes? So if I find out some elements in the diet in diabetes, then probably I can give some healing touch on that. So then I planned my talk. So how to give healing touch in the elements of diet in diabetes? So then I planned my talk like this. I will talk a little bit about the medical nutrition therapy, what is medical nutrition therapy and why it is important, and what are the elements of diet, particularly in Indian context. What are the perceptions, awareness and practices, what is going wrong. And then I will touch upon little bit about the glycemic index and glycemic load, because without touching the glycemic index and glycemic load, I think the talk would be incomplete. Then I will little bit touch upon the healthy meal planning, how to plan a healthy meal. Then I will talk little bit on the role of protein and fiber, which are the two important component of diet, I think, in diabetes. And then I will also talk about little bit on the role of diet in improving the glycemic variability. And with this respect, I will talk on the role of diabetes-specific protein supplement in improving the various parameters in type 2 diabetes mellitus, and then I will give some take-homes. So let us start with these interactive questions. All of the following foods are of high glycemic index except white bread, polished rice, rasgulla, watermelon and chocolates. Please raise your hand and please reply the question. Except one. Watermelon. Any other taker? Watermelon. So there are few takers, but all are in favor of watermelon. So let us finish my talk, and then again you can reconsider your reply. So what is medical nutrition therapy? Medical nutrition therapy is the term which is a term which is an indispensable component of diabetes management. This is specific to diabetes. So, but remember that medical nutrition therapy is also applicable for other lifestyle disorders like cardiovascular disease, hypertension, and kidney disease, etc., etc. So, medical nutrition therapy in diabetes is an indispensable component of diabetes management, which includes counseling and also recommendation for dietary intake and nutrition goal by a registered dietitian or qualified nutritionist to improve the glycemic control and other outcomes. So, what are the important goals of medical nutrition therapy? So, definitely one of the important goal is to promote and support healthful eating pattern and maintain pleasure of eating. So, remember that we should not compromise the pleasure of eating, or we should not compromise the palatability of eating. So, we should try to plan a balanced diet and healthy diet so that eating pleasure and palatability is not compromised. We should also address individual nutrition needs, because in case of children there could be need of nutrition which can help in gaining their weight and also promoting their height, and also in some of the complications of diabetes like CKD and also liver disease, and so also heart failure, there can be some issues of extra salt and other proteins, extra proteins. So, we should individualize the diet pattern, and then we should provide practical tools that promote healthy eating patterns. So, let us review the recommendation from the various guidelines, ADA and ICMR, our guideline, and RSSDI 2022. So, regarding the carbohydrate, no ideal macronutrient distribution they recommended according to the latest guideline, but the recommendation regarding the protein is 0.8 gram per kg of body weight per day. And regarding the saturated fat, they recommend less than 10%, and we should choose MUFA and PUFA and limit trans fat as far as possible. As far the our guideline is concerned, ICMR, they recommend 55 to 60% of the energy should come from protein, and fiber should constitute 40 gram per day. And similarly, RSSDI also 50 to 60% of the protein should constitute the total energy, and fiber should be of 25 to 50 gram, 40 gram per day. And regarding the protein, approximately 12 to 15% of the energy, and regarding the fat, less than 30%. So, more or less similar. So, what about the perception from the Indian context? So, let us see this survey. This survey was done across the India, including the all regions, including the age group above 21, including also 61 and above. So, what was the result? You can see the 95% of the participants, they were actually aware about the importance of protein consumption, and 92% of the participants, they were aware about the importance of the fiber consumption. On the right side of the panel, you can see that actually 14% of the participants, they made their protein requirement, but 86% they thought they made their requirement, but actually 14% they made their actual requirement. Regarding the fiber intake, similarly 81% they thought that they made their requirement, actually 21% they made their requirement. So, there is a wide gap. This is from the STARS study regarding the composition of the diet across the India. You can see, irrespective of the region, irrespective of the state, or irrespective of the whether it was rural or the urban, there is predominant carbohydrate consumption. Approximately 64% of the energy of a diet comes from the carbohydrate. And this increased intake of carbohydrate actually contributes to the increased postprandial glucose excursion, and it was seen that 62.5% of the participants, they had their postprandial glucose level more than 180. and they did the subgroup analysis, you can see those who took their 60% of the energy, less than 60% of the energy from carbohydrate, they had less postprandial glucose excursion in comparison to those who consumed more than 60% of the energy from the carbohydrate. There was a clear difference, 206 and 224, the mean postprandial glucose. So what is going wrong with the Indian, in the Indian context regarding the diet in diabetes? So Indian patients, they are not aware about the food groups, particularly they still lack the knowledge about the food and protein. All takes more of carbohydrate, so carbohydrate rich food. Low protein diet, 20% may be meeting up to the mark, but still there is a wide gap of 80%. Portion size also varies according to the region, and switching over from rice to wheat is very common, but it is carb to carb change, so overeating of chapati could be a concern. Lack of knowledge practice to incorporate vegetables in different meal times is also lacking. Fried food should be avoided, but it is they usually avoid fried food, but taking biscuits could do a lot harm. They are full of carb, dalda, maida, etc. And fruit juice in a state of whole fruits, this is very common, and fruit juice is very full of sugar. And because of the less time and ready to eat, online habits are very much prevalent. Now I am going to talk on glycemic index and glycemic load. So what is glycemic index? Glycemic index of a carbohydrate diet or carbohydrate meal actually describes its postprandial glucose excursion or response over a period of 2 hours in the form of area under the curve when it is compared with the standard food or reference food, which is usually of 50 gram glucose or 50 gram of white bread, or white bread which contains 50 gram of carbohydrate. So it measures the food and puts the food in a rank from 0 to 100. So according to the glycemic index, food can be divided into 3 categories: low glycemic index, the glycemic index up to 55, medium 56 to 69, high 70 and above. So what is glycemic load? So glycemic index is itself is not sufficient enough to know the postprandial glucose excursion. We should know the glycemic load as well, because it measures both the quantity as well as the quality of the carbohydrate. So here the quantity of the carbohydrate is also considered. So dietary glucose load is calculated as the product of glycemic index into the amount of carbohydrate taken. So according to the glycemic load, food again can be divided into 3 categories: less than 10, between 11 and 19, more than 20. So only it is not the food which is responsible for the glycemic index. There are many other factors which could also play in the glycemic index, like the physical and also as well as the chemical structure of the food. Fiber content of the food, more the fiber, less is the glycemic index. Cooking methods, cooking process is also important. During cooking, many other ingredients can be added, and the less processed food has the less glycemic index, and higher processing food has the high glycemic index. Presence of absence of fat, increased fat reduces the glycemic index, but we should keep in mind a given food can elicit highly variable responses according to these affecting factors. So how to meal a plan or healthy meal for a diabetic patient? So we should not customize a meal plan for every patient. Rather, we should individualize the meal plan for each and every patient. So meal planning with glycemic index involves choosing foods that have a low or medium glycemic index. So if eating a food with a high glycemic index, you can combine it with a low or medium glycemic index food to help balance the meal. And mind that meats and fats do not have a glycemic index. Only carbohydrate, they constitute the glycemic index. So how to lessen the glycemic index? So there are many ways how we can lower down the glycemic index. We can add legumes and high fibers vegetables to polished grains to lower the GI. We can use coarse grains. We can incorporate other ingredients like condiments and ginger, etc., etc. We can include protein sources. We can choose parboiled rice. We can use healthy fats as well. So there are many methods how we can lower the glycemic index. So this is a healthy plate. You know about this. This plate is of 9-inch diameter. So you tell the patients to divide it into two halves, and again you tell the patients to divide it into one half, divide it into again two halves. So that plate is 3 portions. So half plate should contain the salad and vegetables, fruits, etc. And 1/4 plate should contain the whole grain, and another 1/4 plate should contain the protein. So this is a healthy plate. Now let us come to the evidences, how low glycemic index food actually improves the outcomes. So there is a meta-analysis which revealed low glycemic index diets are effective in reducing HbA1c, fasting plasma glucose, LDL-C as well, but no significant effect on fasting insulin, HOMA-IR, LDL-C, HDL-C, triglyceride and insulin requirement was found. Now I am coming to the importance of fiber in the diet. You can see on the left side of the panel, soluble fiber supplement approximately 10 gram per day in individuals with type 2 diabetes mellitus for a period of 8 weeks only. They have it has the huge impact on the fasting plasma glucose level as well as the HbA1c level. There was significant reduction of the fasting plasma glucose level from 163 to 120 and HbA1c from the 8.5 to 7.5% point. On the right side of the panel, you can see again another study where control diet, that is the ADA diet, and the 20 gram diet fiber was added on the top of ADA diet. You can see there was a huge impact in reduction of the fasting plasma glucose after a period of 1 month, the 19% lowering of the fasting plasma glucose level. Now I am coming to weight changes in diabetes patients. So there is a term called dynamic weight changes. Sometimes we see patients, the patient gains weight, sometimes we see patients lost weight. So this is dynamic weight changes. Individual with type 2 diabetes mellitus may experience these dynamic weight changes over the course of the time. So why it is important? So dynamic weight changes can happen because of the many reasons. One of the important reason is uncontrolled glycemic status of the patients, and that leads to loss of lean muscle mass or lean tissues. That leads to sarcopenia. It has been seen in studies, individuals with diabetes are reported to have significantly lower percentage of skeletal muscle mass, especially in the lower extremities, as compared to the healthy controls. And lower body weight or low body mass index is associated with poor outcome in patients with type 2 diabetes mellitus. And patients with lower versus higher body weight may experience more cachexia, wasting and fertility. This is called obesity paradox. And unintentional weight loss of more than 5% is associated with all-cause and cardiovascular mortality, and it is considered as a marker of loss of physiological reserve and loss of fat-free mass, including the bone and muscle mass. So unintentional weight loss associated with risk of cardiovascular disease that was seen from examine studies. This is the cardiovascular outcome trial which was done with allogliptin. So in that trial, you can see the post hoc analysis or the subgroup analysis where the weight loss of more or equal to 5% and 10% were independently associated with higher risk of cardiovascular and all-cause mortality. That was very nicely depicted with the red line. And there was 2.5 times greater risk of cardiovascular mortality in those who had more than 5% of weight loss. Now I am coming to the protein gap, which I have mentioned in the initial slides, that there is a protein gap in India. So in India, 9 out of 10 people, they do not receive enough protein in their diet. And according to the National Institute of Nutrition, ICMR, what India eats report, proportion of population consuming recommended more than 66% protein from pulses, legumes, nuts and milks, fresh foods, which have good quality protein, were only 5% among rural and 18% among urban populations. So this STARS study I have already mentioned that showed that only 14% of the energy comes from the protein. In the STARS study it was shown. Now coming to the protein quality. So I have mentioned that only 5% of the rural Indian and 18% of the urban Indian, they are consuming good quality protein. That was seen from that study. So good quality protein which contains all the 9 essential amino acids in right proportion. So usually pulses are deficient in methionine and cereals are deficient in lysine. So we have to combine the pulses with the cereals or the grains, so then it makes a complete protein. So this is protein complementations. Combining two plant proteins or one plant protein with another animal protein is called protein complementations to have all 9 essential amino acids which are required by the body. So you can combine one with the another. Now I'm coming to the importance of dietary fiber in the weight and blood glucose management. So if you increase the dietary fiber, it can have many benefits. It can provide many benefits through many mechanisms, like during the chewing, it increases the salivation, therefore it helps in weight management. In the stomach and small intestine, it reduces the level of free fatty acid, cholesterol, glucose and insulin through various mechanisms, therefore it improves the blood glucose. In the large intestine, it increases the level of small chain fatty acids like butyrate because of the fermentation of gut microbiota compositions, and also reduced inflammation, that is meta-inflammation. Now we all know the type of fibers. There are two types of fibers, soluble fiber and insoluble fibers. Soluble fibers are mainly from oat, bran, barley, etc., etc., and insoluble fiber are mainly from whole grains. So there are many benefits like glucose control, weight management, cholesterol control and digestive health. Now I'm coming to the evidences regarding this fiber replacement for fiber supplementations. The recommendation is 10 to 20 gram per day, approximately at least 10 gram per 1000 kilocalorie per day. So 10 to 20 gram per day in individuals with type 2 diabetes mellitus has shown to reduce the body weight and waist circumference. So fiber recommendation is 25 to 40 gram per day, which plays a role in weight and obesity management. So protein is an essential nutrient helping in weight management by increasing satiety, increase in energy expenditure, promoting muscle mass synthesis because of the supply of amino acids. Protein intake of 1 to 1.2 gram per kg per day shown to reduce the body mass index, waist circumference, fat mass, insulin resistant, and improves the muscle mass as well. There are studies as well, Campos et al. They found that more weight loss in people with metabolic syndrome patients when the patients were given 1.34 kg gram per kg of body weight per day of protein. In another meta-analysis, Dr. Dong J et al., they have showed that high protein diet was found to have beneficial effect on weight loss, HbA1c level and blood pressure as well. So protein recommendation is 1 to 1.2 gram per kg per day. Now I am coming to macronutrients. The mind that there was no current recommendation of routine supplementation of the vitamins above the recommended daily allowances, either to prevent the complications of type 2 diabetes mellitus or development of type 2 diabetes mellitus, unless there is any underlying deficiency state. So reducing the diabetic patients, they have sometimes antioxidant deficiencies like A, C and E deficiency. So in those cases you can supplement. Vitamin D has been shown to be associated with development of diabetes, but it has no clear-cut evidence in the improvement of the diabetic status. And absorption of vitamin B12 may be an issue, particularly in patients those who are getting metformin. And hypomagnesemia and chromium also has got some role in the insulin sensitivity, magnesium replacement and chromium replacement. Now I'm coming to the last part of my talk, that is glycemic variability. We all know about that, but how to combat this glycemic variability? There are many ways. One is definitely the changing of the medication. So oral anti-diabetic drug which are responsible for the higher glycemic variability could be replaced by the
please
drugs.
Come up.
Yes, 2 or 3 slides. So that could be replaced by the glycemic drugs which has less glycemic variability. So diet is a very important factor in modifying the glycemic variability. So I have mentioned that low glycemic index food is very important, and food order, this particularly if the patient takes vegetables and proteins in the beginning of the meal, that can also lower down the glycemic variability. Low carbohydrate diet definitely, and high protein and high fiber diet. So there is a role of diabetes-specific protein supplementation in diet, in diabetic patient as well, particularly in some conditions like when there is obesity associated with diabetes and malnutrition is associated with diabetes. So this is evidence from that protein improves glycemic variability. You can see that in 10 healthy adults, 0, 5, 10 and 20 gram of protein from glycemic index lowering peptides was added to a 50 gram of glucose drink, and the glucose was measured, capillary glucose was measured at 15, 30, 45, 60 and 90 minutes and 120 minutes. You can see that 20 gram of protein significantly reduced this postprandial glucose excursion, which was depicted by the lowest line. So DSPS has some scientific design as well, mainly regarding the composition of macronutrient and micronutrient. It has high fiber content and high protein content as well. It has been shown that it can accelerate wound healing in patients with diabetic foot ulcer as well. It can improve glycemic control and also variability, and it can reduce the hospital stay, particularly in hospital setting. So the takeaways is medical nutrition therapy is an integral component and a cornerstone of diabetes management, not only in type 2 diabetes mellitus patients, but also type 1 diabetes mellitus patients. A balanced diet with the help of MNT plays an important role in the management of diabetes and reduces the risk of diabetes complications in the long run. Individuals with diabetes in India, they consume higher than recommended amount of carbohydrate and lower proteins and also to some extent fibers. Apart from type of carbohydrates, many other factors can also influence the glycemic index of the food. Glycemic index is important, but glycemic load is also very important. Upregulating protein and fiber in the diet plays an important role in reducing the glycemic index as well as the glycemic variability, which in turn reduces the risk of complications. So diabetic-specific proteins supplement help to bridge the gap between the insufficient protein intake and the increased requirement in people with diabetes in Indian context. So with these, I would like to stop here.
Thank you, Dr. Baidya, for explaining in a very nice way about various components of nutrition, reducing carbohydrate, increasing protein, and especially vegetarian protein, because that is not loaded with high fat content, and importance of fiber in reducing glycemic index as well as glycemic variability. I will like to ask one question that is common, that we are consuming a lot of palm oil in India as a cooking media. So how palm oil stands in diabetic nutrition? Is it damaging, or what is the status of palm oil?
I think the palm oil is unhealthy oil because it contains more of trans fat and saturated fat. So that is there is a recommendations that regarding the trans fat, as far as we can reduce the amount of trans fat, but the saturated fat, it should be less than or 7% of the total calorie. Yes.
Okay, so one or two questions from the floor.
Take the fruits at the beginning of the meal or the end of the meal? Is there any guidelines?
Actually, in between the meals. Actually, in between the meals. If you take more fruits in the beginning of the meal, that can increase the postprandial glucose because of the high glycemic index of some of the foods. Not all foods, but some of the foods.
And the answer of the question that you have shown.
Watermelon or non-watermelon?
Oh, okay, okay, fine. So now I think the audience can reconsider their answer. Watermelon actually contains 80 to 90% of the water, but it has very high glycemic index. The glycemic index, we compare the amount of glucose raised over a period of 2 hours with 50 gram of glucose or 50 gram of carbohydrate in white bread, similar amount of carbohydrate in white bread, with the same amount of carbohydrate, that is 50 gram of carbohydrate from the another category of carbohydrate food. Am I clear? Are you clear?
Not really.
No,
so area under the curve, suppose after 50 gram of glucose ingestions, blood glucose rises from the baseline, blood glucose rises 100. And after taking white bread, which contains 50 gram of carbohydrate, blood glucose rises, say for example, 80 milligram. So area under the curve, this difference or this area under the curve is actually the measure of the glycemic index. It is measured in percentage. So 80% is the glycemic index of the white bread. So am I right? Am I clear? So then you can similarly, you can get the glycemic index of any carbohydrate food. Say for rice, if the polished rice increases the postprandial glucose, polished rice which contains 50 gram of carbohydrate, the amount of rice which contains the 50 gram of carbohydrate, which rises the blood glucose after a period of 2 hours, say for example 70, then its glycemic index is 70. So this glycemic index of watermelon is very high, but the glycemic load is low because 80% or 90% of the constituent is of water. So if you take 100 gram of watermelon, actually you are taking 10 or 20 gram of watermelon. So though the glycemic index is very high, but the glycemic index is low, but the glycemic index is low, glycemic load is low, but the glycemic index is high. On the other hand, the chocolate, which has very high fat content, so that it lowers down its glycemic index. So the chocolate is the answer.
Okay, thank you. And just one point that, as we all know, that protein is good and it should be taken, in greater quantity. But according to NI in Hyderabad, initially the recommendation was 1 gram per kg per day, but they have reduced it to 0.83 grams.
Yes.
So what is the purpose? Why?
The recommendation is, I think the range is 0.8 to 1 gram per kg per day. Not a clear cut 0.8 gram per kg per day. The ideal recommendation is 0.8 to 1.
Yes,
the range.
Yes, previously it was 1 and now
if
it
there
has
is
been
no
0.83.
0.8
recently.
I do not know the reason why they have reduced this cutoff. Lemon juice.
Lemon juice, number 1. Number 2, guava. Number 3, cucumber.
Number 3 is the
Cucumber. Sure. Cucumber.
Cucumber contains lots of fibers, and the glycemic index that's why is very low. Usually we should not consider it as a fruit. We should consider it in salads, actually in vegetables or salads. And regarding the fruit juice, as I have said that fruit juice it does not contain fibers. Rather, whole fruit contains fibers. So it lowers the glycemic index, but on the other hand, the fruit juice, which is processed, which is made outside, that increases the glycemic index because of the lack of fibers and other constituents. So that causes the sharp rise of postprandial blood glucose. Emni levu. I think there should not be any concern, the lemon juice.
Okay, thank.
Don't drink fruits, eat fruits.
Okay, it's a very. Do you have any questions?
These days, lot of studies are coming that showing that consumption of both the fermented and non-fermented dairy products is associated with long-term cardiovascular morbidity and mortality, and also the incidences of cancer. So, lot of controversial studies are now coming. So, what is your take on that?
Fermented products actually contains lots of beneficial bacteria, so that can improve the gut microbiota status. So rather that can reset the gut symbiosis. So that I have shown one of the slides, and I have touched upon those aspects little bit. That how fiber improves the glycemic control and it has got other benefits like inflammations. So that resets the gut dysbiosis. It causes the symbiosis of the gut microbiota, as the fermented products contains lots of favorable bacteria which are important for the prevention of the inflammation, and it increases the small chain fatty acids in the colon, in the large intestine. So that is beneficial actually. That prevents meta-inflammation, that prevents inflammation in the intestinal wall.
Okay, thank you. It's a very nice and interesting session, but because of time constraint, we cannot allow any more questions. So we are concluding the session now. Thank you all.
Thank you, Speaker. Thank you, Chairperson. It's time to felicitate our Speaker. I would like to request our Chairperson to please felicitate him. And now I would like to request Dr. B.P. Pandey to please felicitate one of our Chairperson. And then I would like to request Dr. Sanjay Shah to please felicitate another Chairperson.